Welcome to today's Medicare 360 radio show. I'm your host, Jennifer Alfonso Lee, certified long term care specialist, investment advisor representative, and founder of Premier 360 Insurance and Financial Solutions. Today's show is one of the most requested topics I get in my office and one of the most misunderstood. How to apply for Medicare at 65, what to do if you're retiring after 65, and the mistakes that can cost you penalties for life. If you or your spouse are approaching 65, working past 65, or thinking about retiring the next few years, this episode is for you. Grab a pen. This information can save you thousands of dollars and years of frustration. So understanding basics before you apply. Before you apply, you need to understand the building blocks of Medicare, which is original Medicare Part A, hospital, Part B, medical, like your doctor visits, outpatient care, and the optional coverage of Part D prescription drugs, Medicare supplement, which is Medicap, Medicare Advantage, which is also Part C. A, hospital, B, medical, D, drugs, usually equals Part C, which is Medicare Advantage. Biggest misconception is Medicare is not automatic for most people. If you don't apply correctly, you could miss coverage, pay penalties, delay retirement, lose employer coverage incorrectly. So those are the things you have to make sure. So applying for Medicare when turning 65, you have your initial enrollment period. You have 3 months before your 65th birthday, and then includes your birthday month and 3 months after your birthday, which becomes a 7-month window. So those are 3 months before, 3 months after. But that doesn't necessarily mean that the month that you apply, you'll get it. So meaning if you apply 3 months before your birthday, it will be issued effective your birthday month, not the birthday of your birthday, but the first day of the month of your birthday. If you do apply 3 months after your birthday, depending on the month, it will be effective the following month. Okay, so if you're the lucky few that are already receiving Social Security, you're automatically enrolled in Part A and Part B. Your Medicare arrives by mail, and you don't have to worry about applying like the rest of us, right? So you could decline Part B if you're still working. So in the back of the card, there is instructions that basically state how to decline that if you are still working. If you're not receiving Social Security, then you must actively apply online at ssa.gov, by phone with Social Security, or in person at SSA. But I would say online is the easiest way. By phone, you set up an appointment. Depending, you don't have to go to your local SSA office, especially when they want you to make an appointment before you come as well. So online, it does get a little bit rigorous because if you've never set up your ssa.gov account, you do have to set that up by either login.me, or I do this every single day for clients. So you would actually have to have an email address and like a cell phone or a number to verify. It is rigorous because you create, you put your email in there, then they ask you to send that email, and then they will ask you to put in your password. Then it will generate another text, and then It asks you more questions. So it is a rigorous process. And at the end, it will ask you to take a picture of your driver's license, front or back, or your ID, and to show your face on your cell phone. So you really do need to have a cell phone. Okay. So then if for some reason you are not able to verify like your face or your driver's license, you will have to go to your local post office to get that verification to get online. It is a very rigorous process. So we help you with that. No problem on that. Okay. So what happens if you apply late? Of course, there are coverage delays, there's late enrollment penalties, and there's gaps in healthcare. So Part A only versus Part A and B. So this is like the biggest thing because some people only take Part A at 65, but this is where the mistake happens, okay? You should only delay Part B if you have credible employer coverage from an active employment through an employer with 20 plus employees, okay? Because credible coverage exempts you from that 10% penalty that you would receive by not being on Medicare at 65. So if you are on a individual plan, Obamacare, ACA subsidized, and cover in California, it's called Covered California, you do need to get Medicare Part A and B, okay? If you are working and you still have group insurance, then that is credible. So you really don't need Part A or Part A and B, right? If you're going to keep your group insurance. However, some people do want Part A because it supplements the hospital portion. And the biggest thing is do not get Part A if you have a health savings account that you are contributing to. Because if you are contributing to health savings account, you just you shouldn't get Part A. Okay. If you are working with an employer less than 20 employees, you do have to get Medicare Part A and B because, why? Because gosh, I lost my train of thought. Because any plan that is less than 20 employees is not credible coverage. Okay. So working past 65, how Medicare works with employer coverage, okay, is really confusing, right? So large employer, 12 plus employees, employer insurance pays first. Medicare is secondary, and you could delay Part B without penalty. So if you are paying for your group insurance, you do not have to get Part B, which you pay for, right? Like, don't double insure yourself and waste money by having two, okay? Small employer under 20 employees, Medicare pays first. That's why you do need to enroll in Part B, A and B at 65. And then the employer coverage pays second. Okay. Okay. Another big question I always get is spouses employer coverage. Rules still apply based on employer size. Okay. So large employer, okay, you have credible coverage. You do not need to get Part A and B. You can get Part A if you don't have a health savings account, but less than 20 employees, you will have to get coverage. So the biggest thing on that is I typically compare your group coverage to Medicare to see which would provide you the most benefits, the lowest amount of premiums, or whatever you would like, right? So it's a comparison because sometimes it's pretty straightforward. My employer plan is wonderful. I don't pay anything, right? Stay on there. But if your employer plan is not that great, you're paying an arm and a leg, then it might warrant you a comparison if Medicare is better for you. Okay. So, what is credible coverage? Not all employer plans qualify. So, keep that in mind. Um, you have to be an active employed. I had this once happen, right? When a client was like, "No, Jennifer, I'm retired, but it is credible coverage because they're paying for it." But once they wanted to get on Medicare, there is a form that employer has to complete that basically says how long they've had credible coverage and active, right? So let's just say, for an example, you turned 65, you decided to stay at work, your group plan was pretty decent, so you stayed on there. And then let's just say at 67, you decide to retire. So at that point, you have to provide the CMS L560 form to your HR department so they can complete that and sign off that you've had credible coverage from age 65 to 67, so you are not penalized that 10% every single year, right? So take for instance a person didn't get that, then they would be penalized 20%, you know, 2 times 10, 20% for their entire lifetime. Might not be much for someone, but why get penalized if you don't have to? Okay, so like some common things that I've seen on this is the one that I mentioned, right? They were not active employed, and it was they got double dinged because it was wife and husband. So keep in mind, even if that employer is paying for your health insurance, you might have to pay penalties because you did not get on Medicare, right? If they don't sign that form that you've been working there since like that time, right? That you didn't have coverage or had coverage with them, that's a big thing. I've also seen delays. Big companies, guys, big companies um, put the wrong date of employment and then going back and forth, then you might be penalized with that too, unfortunately. So be very careful and mindful that your employer, will still be in business, or you're going to find someone that um, the HR to fill that form out, right? Most employers know about this form. You're not the only one that's retired or wanted Medicare, but some may not. So be just cognizant that in order to avoid the penalty, they need to make sure that it shows how long you had that credible coverage. Okay. So, not to harp again, but the health savings warning: once you enroll in Medicare, you must stop contributing to an HSA. And Medicare backdates Part A up to 6 months. So, this mistake alone causes major tax issues. So, okay, let's back up because this is a little bit confusing. Okay, so let's just say you did not apply for Part A or Part B at 65. You keep working, but let's just say you want to retire at 67. So when you apply for Part A and B, the B will be effective when you want it to be, right? Like the month after you retire, right? Or you don't have coverage. The Part A, they backdated 6 months before your Part B effective date. So please keep that in mind, right? Because if you're contributing to a health savings account, um, stop 6 months before you retire. I know sometimes you're not going to know, but just keep that in mind because, like on paper, when I tell clients it's okay because you could just backtrack and remove it from your taxes, but clients have told me that it has caused many tax issues for them, right? Like really good clients that are just they know and they're very savvy when it comes to this have told me it's a nightmare and like it just I guess it's in a pain in a butt, right, to backtrack and figure all that out. So keep that in mind as well. Okay. So how about when you're retiring after 65? What's the steps to do for that? Okay, this is where the penalties happen most often. Your special enrollment SEP, okay, you do have 8 months after enrollment ends to enroll in Part B, okay? But only 2 months after that to choose a Medicare Advantage or Part D plan. But the biggest thing is like I've seen this and I've seen where people still get penalized. And why wait 8 months to enroll in Part B, right? I know sometimes people have Cobra. Sometimes Cobra is still more expensive, right? I just wouldn't chance it from like the issues I've seen, right? But technically, 8 months after employment ends, that's when you can enroll. Okay. So the critical forms is going to be the CMS 40B, enroll in Part B, and then the CMS L564 employer coverage verification. Okay, if I have time, we could break that down. Okay, so common retirement mistakes is waiting too long to apply, right? I don't know, you just didn't get around to it. Cobra is not credible for Medicare. So remember that. I met someone who waited 1 year because they were on Cobra to get on Medicare. And she actually called Medicare and asked them, is Cobra credible coverage? And they said yes. And guess what happened? She got penalized, and it took her 1 year to rectify the situation. I mean, the penalty probably wasn't as bad, but the aggravation of calling and calling for hours on end, calling her constituents like Congress people, and it's just it's stressful. I probably would have just gave up, right? So Cobra is not credible. Remember that. Okay. Assuming HR handled enrollment, human resources not. I've only had one time which human resources said, "Oh, we'll send it up to Social Security." Don't leave it to chance, right? We send it up for clients. We do not want to leave it to chance, right? Who knows if HR did it? So I wouldn't leave that to chance. Okay. Missing drug coverage deadline. Hey, when you get your Part A, hospital, Part B, medical, there's an invisible drug plan there, right? And some people are like, I don't take drugs. I don't need a drug plan. But you have to get a drug plan to avoid that 1% penalty. Okay, so keep that in mind. So drug penalties, 1% every month that you were not on a drug plan. Okay. Added for life, which is horrible. Applies even if you don't take medications now, like I mentioned. Okay. So choosing coverage after you enroll. So now what, right? You got all through this. Congratulations. The option one is original Medicare plus a Medicap plus a Part D. Okay, this is the freedom to choose doctors, freedom to go anywhere in the United States, and go anywhere that accepts Medicare, which is probably 99% of the time. Okay, these are higher monthly premiums because on top of paying your Part B premium, you do have an additional premium to pay to the insurance company. Lower out-of-pocket costs, so it's fixed because you know exactly how much you're paying and your deductible every year. Okay, so option two, Medicare Advantage, lower premiums, or even at zero or money back. There are network restrictions, right? You have most of them are HMOs. You have one doctor that refers you to all your specialists. Sometimes there are PPO options, right? But they're limited. They're starting to be limited. Okay, prior authorizations, and there is maximum out of pockets. Depending on the county or state you're in, you could go so low. There's some that are as low as 199, and there's some higher, right? So, who should be careful with Advantage plans? Um, if you're a snowbird and you're in New York and you travel to Florida in the summers, right? That might be a bad thing. If you have multiple specialists, just chronic conditions, you just prefer doctors outside a network or just want to go to different medical groups, that's the disadvantage of Advantage plans. Um, and then there are disadvantages on Medigap, right? The premiums, and then when you travel overseas, it's less coverage too. But that's probably another topic that we will go over. Okay, so top pitfalls that cost people thousands. Okay, mistake number one, assuming Medicare is automatic. It's only automatic if you've been on social SSDI disability for 2 or more years, and if you are getting Social Security now. Mistake, taking advice from coworkers or friends. Everyone's situation is different, okay? So keep that in mind. Mistake number three, delaying Part B incorrectly, right? If you're not an active employee, if you don't have credible coverage, that's a big one. Mistake number four, not understanding employer size rules. Keep in mind 20 plus, large employee, credible coverage. 20 or less, not credible coverage, you need to get on Medicare. Mistake number five, missing Part D enrollment. So Part D, even if you're not taking prescription drugs now, just get a really cheap one. Most Medicare Advantage has it, so definitely look into that. Mistake number six, not reviewing plans annually. Sometimes there's terminations. Sometimes your formula, your plan changes, the cost could skyrocket, right? So keep that in mind. Mistake number seven is not planning for long-term care. Many think Medicare is going to cover it. It's not. The extended care after the skilled nursing of 100 days is on you, right? If you are on Medicaid, there might be some options for you. Some plans have a little bit of extended care, but not all. So keep that in mind. Okay. So, just pro tips, because I do this every single day. Apply early and not late. Okay. You just don't want to be stressed. I've had clients where we submitted it, and it takes months to get the part A and B. Okay. Get everything in writing, of course. Verify your employer size. Track your deadlines. Review coverage annually. Work with a licensed Medicare professional, an independent licensed agent. So I didn't have time to go on the LMS L564 and the CMS 40B. So that's probably something I definitely want to go over. Want to go over the IRMA rates next week as well. So yes, I think I'm really passionate about this. I do it every day. Clients could do it like an hour and I could do it in 20 minutes for you. Okay. Okay, so if you're turning 65, retiring after 65, or helping a spouse or parent through Medicare, you don't have to do this alone. At Premier 360 Insurance and Financial Solutions, we do help people apply for Medicare correctly, avoid lifetime penalties, coordinate employer coverage, choose the right plan, and prepare for your healthcare costs in retirement, right? I know you could probably chat GPT now, all this information, but with just a guided professional who is licensed and certified every single year to guide seniors or Medicare eligibles, we know the ins and outs. And I know everyone wants to do things themselves now, but hey, for no cost, why not have that extended help for you so could ease your stress. So thank you once again for tuning in. My name is Jennifer Alfonso Lee. your Medicare 360 radio show host. You have a wonderful day. Bye bye.